Our medical technology community today will discuss about on Widal test. Basically, a Widal test is a serological method to diagnose enteric or typhoid fever that is caused by infection with pathogen microorganisms like Salmonella typhi and Salmonella paratyphi A, B, and C. The method of this diagnostic test is based upon a visible agglutinations reaction either in a test tube or a strip test on a slide between antibodies of patient serums and antigen specifically prepared from Salmonella species. Basically, we will mix the industrial paper regions of Salmonella typhi and with patient serums. That's agglutination on based. Antibodies appear after a period 2 to 3 weeks in a serum of the patient. Typhoid fever is an acute, life-threatening and fever-causing illness transmitting by the ingestion of food or water that contaminated with the feces of person infected with the bacteria Salmonella typhoid, Salmonella paratyphi, A, B, and C. The test measures agglutinating antibodies directed against a Salmonella or somatic surface antigen. Salmonella H. flagella antigen of the suspected organisms. The Widal test directed antibodies against O and H antigen, type of technique used to direct agglutination. Widal test developed by Ferdinand Widal in 1896. Typhoid fever symptoms: high temperature, fetal weakness, headache, gastroenteritis, and diarrhea. And these signs and symptoms are including in it. Laboratory diagnosis of typhoid. Number, methods, time consuming. Widal test of a rapid slide screening test, 1 minute. Widal test by tube agglutination test, 3 to 4 hours. Typhoid test, IgG, IgM rapid by chromatography, 15 minutes. Tube XTF, 10 minutes. ELISA, 45 minutes. PCR, 7 to 10 days. Principle of Widal test: antibodies in the serum produced in response. Material and reagents provided with the Widal test: antigen suspension specifically prepared from Salmonella species antigen OH and AO, AH, BO, BH, CH. Exclude these type of antigen suspension, especially these terms, because these serotypes are not present in condition regions, positive control and negative control. While Widal test, typically patient serum is diluted in a series of tubes or vials on a slide and reacted with the bacterial antigen specifically for the suspected disease. The test measures agglutinating antibodies directed against a Salmonella or somatic surface antigen and H. flagella antigen of the suspected organisms. Widal control: Widal negative control contain no antibodies against the specific bacteria. Widal positive control contain ready to use standardized goat antiserum with polyspecific antibodies have specifically react towards Salmonella typhi O and H antigen. Note: a positive and negative control should be run with each test. If the reagent fails to agglutinate with the positive control or does agglutinate with the negative control, it should be discarded. Additional material and reagents required of febrile agglutination test: applicator, stick, glass plate or card, plastic slide or disposable test, pipette or plastic dropper, sterile saline 0.85%, test tube, timer clock, water bath temperature controller. Rapid slide screening test procedure: place one drop and observation and results. Approximately 75% of cells are clumped is equal to 1 in the ratio 3:20. Approximately 50% of cells are clumped 1 ratio 160. Approximately 20% of cells clumped 180 where novel attention is equal to negative. Patient history should be taken in account before giving the results. In positive, it may be confirmed to serological test or bacillus. Interpretation: Salmonella typhi O positive mean decent infection, and these terms may be included. Summary: the Widal tests are very low, specifically less sensitive, confusion, and difficult to interrupt of diagnosis of typhoid fever because cross-agglutinating antibodies remaining from the positive, while more test is not available like typhoid test, but the Widal test is still considered used to diagnose it. It concluded that even today, the Widal test remains one of the best, easily accessible, cheap, and simple method to diagnose typhoid fever.